While I was in the Air Force, I was a flight surgeon. The Air Force sponsored me through a civilian program in orthopedic surgery. I was an orthopedic surgeon in the Air Force for 17 years. I hate to say it, but I can relate with a lot of my patients. I've had my knees operated on, I've had my shoulders operated on, I've had broken bones. I know what it's like to hurt. It's kind of nice to be able to relate to the patient and say, hey, been there, done that, I understand. Albin is an avid golfer. Came into me and had shoulder pain.
I was out at my ranch doing some brush clearing, and I just picked up a little limb and tossed it to my daughter and had this loud pop and pain in my right arm.
He had something called Impingement Syndrome, and he was getting degenerative rotator cuff tears. So we were able to return him back to his golf game, pain-free, after a procedure to remove the bony impingement, repair his cuff. A few years later, comes back in bilateral knee pain.
My knees had just been so bad and so much pain and walking and limping, and just really affected everything I did.
Conservatively treated him to try and get rid of his pain, using everything from non-steroidal anti-inflammatory drugs to braces to activity modification. Couldn't get any better, so we elected to do total knee replacements.
He replaced both knees on a Tuesday. I went home on Friday and started therapy on Monday. 6 weeks later, he released me for full golf. I recovered so quickly.
He worked hard, did his physical therapy, because the surgery is a small part. The rehab takes quite a few months.
I don't hurt when I'm playing golf. I don't hurt after I work out. It's just a real nice, normal life for a 67-year-old.
Nathan, on the other hand, is kind of a different story. Nathan was active and still is active in weightlifting.
I was familiar with Arlington Orthopedic Associates. My left shoulder first separated and came out of place in the gym.
He came in, he had acute pain in his shoulder, worked him up, he had signs and symptoms, and sure enough, he'd torn his rotator cuff, torn it right off the bone.
After reading the MRI, he didn't even really know how I was moving around because I had blown every tendon possible off my shoulder.
I gave him his options for treatment. He's active, he wants to get back in that gym, he doesn't want instability. Went in, fixed him, rehabbed him. He is back in the gym, totally healed, full range of motion. I think he's as big as ever now.
From that point forward, I've had a couple more surgeries, and there is not another orthopedic that I would recommend stronger, nor would I even consider going to. There's patients like me that are impatient to get back into the weight room, and he understood and he respected that.
Nathan and Albin are probably two of the best examples of doing it right as far as the rehab. It's rewarding when people get better and get back to a functional lifestyle without pain.